Okay, this video is the Mediterranean diet the Antichrist? And why do I even talk about the Mediterranean diet? Because it is by far the most popular diet with conventional medicine. All the big famous universities that I've ever seen strongly recommend the Mediterranean diets. They even put posters up about it. They even have, uh, you know, weight loss, bariatric, nutrition conferences where they'll have speaker after speaker promotes the Mediterranean diet. And I just want you to know you should not trust them. They're a bunch of liars, they're ignoramuses, and they are incompetent. Okay? So, is the Mediterranean diet the Antichrist of nutrition? Yes, it is. Why? Because it promises salvation of health, but it causes the opposite. It makes people fat and sick. What does it forbid? It forbids almost nothing. It encourages olive oil, canola oil, and some other oils. All oils are toxic to your arterial lining, okay? They make you fat. All fats make you fat. That's bad. And then even omega-3 fats are bad, okay? They're immunosuppressant. They increase your risk of prostate cancer. They make a person gain weight, which over time increases their risk of diabetes. They're thought to have an immunosuppressive effect. You don't want that. Okay, what else? The Mediterranean diet encourages chicken and fish. It tries to pretend that there's some big difference between chicken and fish versus beef. There really isn't much difference, okay? Beef's going to be a little higher in iron. Beef's a little worse, a little more, xenocylitis and stuff. So what? They're terrible foods, chicken and fish. You shouldn't eat them at all. Not one bite. Fish is, mercury land, and it's really acidic. There's other problems with it too. You don't want it. Dairy. There's no animal that drinks milk after it's weaned. There's tons of problems with dairy. You don't want one drop of it after you've been weaned from mama. Okay? The only reason for dairy is our ancestors, when they had to survive a cold winter, it would be nice to have, a cow around and have milk in the cold winter. Okay? It can turn the grass into milk. But in terms of optimizing health in the modern world, it's bad for your health. It's strongly associated with all these autoimmune diseases, allergies, etc. Okay, cheese. Cheese is dairy, basically. And, the old joke is when you eat cheese, you look like the animal where it came from. Okay, a cheese pizza looks the same on your plate as it does inside your artery. That's a typical gross appearance of atherosclerosis. Okay, alcohol. You don't want one drop of alcohol. Alcohol is for chumps, okay? Alcohol is like to sterilize stuff, to kill stuff. You rub it on the skin and you can draw blood immediately afterwards. Alcohol is toxic, okay? I mean, I realize there's different types of alcohol, but you don't want it. That stuff about 1 or 2 drinks a day being cardioprotective was all BS, all right? So we're not going to go into that right now, but you don't want to drink alcohol. It's best to not have one drop of it, okay? I've seen alcohol ruin people's lives numerous times. Okay, soy. Soy is for chumps, okay? In my opinion, the reason why soy is subsidized is to sterilize low IQ people, okay? Look what it does to sperm counts. Look what it does to the female reproductive tract. And yeah, I know a lot of famous docs have recommended it, and in my opinion, it's because they're lazy and they haven't read the papers. If you go back and read the papers before it became, a billion-dollar commercial product, there's tons of problems with soy, and you don't want anything to do with it, okay? And McDougall knows that too, and he writes about it in Starch Solution, but he's a little more politer and diplomatic than I am, okay? All right, sweets. Sweets, you don't want to be eating sweets, okay? I'm not going to get into all that, but there's reasons why you don't want to eat sweets, especially any type of candy or any of that kind of stuff, because then you're going to have the food dyes in there, which are pretty routinely mitochondrial inhibitors. Processed foods in general include mitochondrial inhibitors, because they're mold inhibitors. They don't want mold to grow in their food or it gets returned to them. They lose money. Nuts and seeds are very high in fat. That's why I recommend avoiding them. Nuts and seeds, you're in the ballpark of like 70 to 90% fat. That's a lot of fat. That's going to make you fat. High-fat diets and obesity cause immune suppression. Immune suppression is associated with increased risk of cancer and of infection, okay? Now, don't get me wrong. That's one of the problems with eating a raw diet is a lot of times a person's not getting enough calorie and then they start eating lots of nuts and seeds. I wouldn't personally go down that path. And, Esselstyn also will say no nuts. They're not organic. And I realize the reason they're not organic, a lot of people say it's because most people can't afford to eat organic. That's true. The economy is getting worse and worse, and a lot of people don't have the money. But I would also make the point, for starches, they're cheap. It's cheap to buy white rice and oatmeal, and they can store for a long time. fruits are great. I like fruits, but fruits are a bit of a pain in the butt to shop for because they don't store very long and they're very expensive and they have seasonal availability issues. Okay, so my point is with all these bad things, how can anybody get better on the Mediterranean diet? Okay, Esselstyn, his diet for coronary artery prevention of myocardial infarction, cerebrovascular events was more than 30 times better than the optimized version of the Mediterranean diet in the Lyon study. Okay, that's a big difference, okay? And that's an optimized Mediterranean diet. In the real world, you tell the patient to do all these things, and in most patients that I've seen, they're kind of half-assed, and I'm cutting down on nuts, seeds, oil, chicken, beef, etc. You want to be biblical, 100%. Thou shalt not eat meat. Thou shalt not eat oils. And people say, well, why am I like that? So absolutist. Because that's what works. You want to get better. You don't understand. These people are screwed. Fat, sick. I always expect every single patient to be fat, sick, and stupid. Okay? After 55 years of age, I just expect it. And most patients are fat, sick, and stupid. When I say stupid, I mean they're cognitively slow. They've lost that zip. They have no capacity for intellectual nuance. They have a low intellectual curiosity. I talk to them about nutrition and health, and they look at me like it's some big joke. They don't get it, okay? And I just see it. They just have one problem after another. Myocardial infarction, diabetic foot, worsened cognitive slowing. They can no longer work. They can no longer drive. It just gets worse and worse. And I'm saying you want to turn that around. And the way you turn it around is you have to cut all the BS. You don't do anything bad for yourself. Give the remaining intrinsic capacity to heal a chance. Okay, what happens with the Mediterranean diet, and why do I think all the big medical centers, and even the real famous ones, where they go for treatment for chronic traumatic encephalopathy, these pro football player celebrities developing cognitive impairment. I've seen a lot of people associated with that treatment movement recommending Mediterranean diet, which is a terrible diet for the brain. And also, it's a terrible diet for the brain. I've talked about that in other lectures. Okay, so, it's the blind leading the blind, conventional medicine. And why do they do it? Number one, because they're lazy and they just want to pretend to look smart. You can pretend to look smart in the conventional medical world if you say Mediterranean diet. But in reality, it's a declaration of complete stupid incompetence. Okay, and it kind of reminded me when the American Diabetic Association used to recommend their high-fat diet. It's guaranteed to make sure the patient continues to have diabetes, as is the Mediterranean diet. Pretty much almost guaranteed they're going to keep getting fatter, sicker, and stupider. And guess what? Once they do that, you can trap them into taking drugs lifelong. Drugs don't almost ever cure anything, okay? Especially not, when I say almost anything, antibiotics can help cure some infections. But for these chronic standard diseases, obesity, diabetes, hypertension, coronary artery disease, renal insufficiency, all the stuff I see all day long every day, drugs can't cure any of that stuff. Low-fat, low-sodium vegan diet cures it most of the time. The system milks them for money, gets them hooked on drugs. They become a chump like this cow, milked every day for drugs. Have to give up their hard-earned paycheck for drug money. All right, the system just takes advantage of them, and the drugs don't work very well. And then they typically end up going on to surgery. Okay, typical patient, fat, sick, and stupid, taking their pills for coronary artery disease. Keeps getting worse. They get a couple stents, keeps getting worse, couple more pills. Then they go for open heart surgery, often end up in MOF, multi-organ failure, progressive decline, pump head, stupid. It's kind of sad and pathetic, okay? And, so why do I complain about it? Well, I'm a little frustrated. I put all this time into kind of becoming a doctor. I want to see some people get better, okay? I want to get some results. McDougall used to say he's the happiest doctor in the world because he probably had the highest percent of patients cured from their diseases out of anybody. And it's nice to see that, It's nice to see patients get better, okay? It's nice to have things be like those old TV shows, Dr. Marcus Welby and all that stuff. Okay, typical patient ends up, like I said, fat, sick, stupid, and broke. The little money they have left, they pour it into all this stupid stuff, and then surgeries, and then they get cancer, and they go for chemo, and they die. Okay, why not be a low-fat, low-sodium vegan and not have any medical problems? Okay, I'm 60. I have 0 medical problems. All right, instead of just falling for the old, sales pitch, match the ill to the pill and send the bill.